A 6-year-old girl presents complaining of pain in her right ankle after tripping and falling in the playground. On physical examination, you note that there is moderate swelling and diffuse tenderness of the lateral ankle joint, with good pulses and normal sensation. Radiographs of the ankle do not demonstrate an acute fracture or disruption of the growth plates. What is the next step in this patient's management? A. ACE wrap, ice, pain medication, and orthopedic referral. B. Emergent orthopedic consult and preparation for the operating room. C. Orthopedic referral, ice, and pain medication. D. Splint, pain medication, and orthopedic referral. E. Urgent orthopedic consult, ice, and pain medication. Answer is D. Splint, pain medication, and orthopedic referral. A child with swelling and tenderness over an epiphysis, for example, of the lateral ankle, and a negative radiograph should be suspected to have an epiphyseal injury rather than a sprain, because the epiphysis is weaker than the overlying ligaments. Which of the following situations requires an emergent fasciotomy in the setting of a clinically suspected compartment syndrome? A. Elevated tissue pressure within a closed compartment. B. Pain on passive stretching of the muscle group involved. C. Tissue pressure less than the diastolic pressure. D. Tissue pressure of 20 mm Hg. E. Tissue pressure within 30 mm Hg of the mean arterial pressure. Answer is A. Elevated tissue pressure within a closed compartment. Controversy exists regarding attempts to define compartment syndromes on the basis of specific tissue pressure. The tolerance to tissue ischemia varies among individuals because of shock, compensatory hypertension, altered tone in resistance vessels, and other unknown factors. Inadequate perfusion and relative ischemia begin when the tissue pressure within a closed compartment increases to within 20 mm Hg of a patient's diastolic pressure or, more accurately, within 30 mm Hg of the mean arterial pressure. When tissue pressure equals or exceeds the patient's diastolic pressure, tissue perfusion effectively ceases. Which of the following is not a manifestation of fat embolism syndrome? A. Altered mental status. B. Hematochezia. C. Petechial rash. D. Respiratory distress. E. Thrombocytopenia. Answer is B. Hematochezia. Respiratory distress and hypoxemia are the earliest, most common manifestations of fat embolism syndrome. Acute respiratory distress syndrome, ARDS, may occur and is the usual cause of death. Neurologic involvement manifesting as restlessness, confusion, or deteriorating mental status also is an early sign, as are thrombocytopenia and a petechial rash. Fever, tachycardia, jaundice, retinal changes, and renal involvement may occur.